So I wanted you guys to meet because Margaret is my close friend, and Dr. Webley I get to work with on COVID health and African American communities. And we had already been talking about how there's a lot of very understandable doubt and concern and fear of the vaccine. And Dr. Webley has a lot of experience with both the fears and the science behind it, the medical stuff. So a lot more than I know. And when you said that you weren't taking the vaccine and people in the Caribbean don't do that, I just immediately thought of Dr. Webley, and it was very nice of you, even though you have a very strong opinion, I know, which is fine. You agreed because we're friends to talk to my other friend, Dr. Webley. So I just wanted to make sure the conversation happened because I knew if nothing else, it would be interesting. So thank you both.
You're welcome.
Yes, yes. So Margaret, I'm a science professor at UMass. I teach.
Science. Okay.
Yeah, UMass is a University of Massachusetts, Amherst, and so I'm a microbiologist. I was trained in how to look at infectious diseases and how to make vaccines against them, and how our body works, how our immune system works. So immune health overall. So some of these things, the reason why I know them is because I've been doing them for nearly 30 years, right? So, that's what I've worked on throughout, and I teach it as well to students who come to college. I teach them about the immune system. I teach them about different microbes that cause disease and all of that. And so I've been following this virus ever since the outbreak started in China.
All right.
I have read very closely everything that has been published on it, pretty much. And then for the vaccines, I followed those even more closely as they have been developed. I've looked at all the reports of all the people who have been in the trials for it. I've looked at the information or the data that they've gotten from the trials. In fact, if I was at the age where I could take the vaccine, I would have gotten it by now.
Margaret, you told me the other day something that's really interesting. You said Caribbean people don't do this vaccination stuff.
We don't take vaccine. I do not.
Can you explain that to me?
Listen to me. We grew up with the doctor should know. We parents grow us up with bush tea and all. Like if we have a fever, if we have a cold. But really, the only thing we take vaccine for, the doctor should know, like when we're supposed to go to school, they will give us this measles shot. But otherwise, things like that, if my mother was alive, she would have tell us, do not take it.
Well, I can tell you that you got vaccines. Do you have a mark on your shoulder?
That go away, doctor, that gone.
But you got it though. That's a smallpox vaccine.
Yeah. For smallpox and
you also got the one for polio.
Yeah, for polio, yes.
Yeah, and for the MMR.
Yeah.
Right. So essentially, in the Caribbean, we get almost all the vaccines.
We were going to school, but something like that, doctor, listen, man. Right now, with my age, honestly, I believe in God. Right? People saying this is a man-made virus. And I tell myself, the only person who could really move this is God, because this vaccine thing, I really am believing it.
So here's the thing. The virus is not man-made.
No, it's not. You know what's going on here?
The virus actually came from bats. It came from bats, probably into another animal, and came into us. So here's the thing. Here's the thing with the vaccine. We don't have a good way of controlling the virus right now.
Yeah, okay.
There's people who are not wearing masks, who are not social distancing. And so that's why people keep, not just here in the United States, but in the UK.
Yes, in the world, yeah.
Caribbean. I actually gave a couple of talks to Guyana, of course, to Jamaica. I didn't do any to Trinidad and Tobago.
Okay.
Of course, they also are wrestling with this virus, right?
Yeah.
And so the way you control it is either that it goes away on its own, or you use a vaccine to control it. The same way you had to control smallpox and polio and measles, right? Is the same thing that's happening here. Vaccination does that. So here's why vaccine work. It's not that you don't have a good immune system or not. It's that when you see a bug for the first time, when you encounter it for the first time, it takes a while before your immune system get up to the place where it can fight it.
Okay.
Understand? But with a virus that is this deadly, that time that it's taking for the immune system to get up to speed, it could kill you.
Okay.
You see what I mean? So what happened is that when you get the vaccine is not the virus, you know. You're not getting the virus. You're just getting a code that make one of the proteins for the virus. So the virus, in order for the virus to survive, Margaret, it has to unlock your cells to get in.
Okay.
So what you're doing with the vaccine is that you're messing up the key that the virus used to unlock your cells. So it has the key that it used to get into your cells.
All right.
What you're doing with the vaccine is that you literally tape up the key so the key can't go into the door to get in.
Okay.
And so if you actually encounter the virus for real after you get the vaccine, you don't get sick.
Okay.
Or the sickness is very mild because the virus can't get into your cells as effectively to cause disease in you. And that's how the vaccine works. Right?
So could I ask that, because my husband is a diabetic. You think he should take it?
Mm-hmm.
He should take it. Okay.
Yeah, because you see, the other thing to Margaret, you remember I was saying that it's actually affecting certain people more than others. People who have stuff like diabetes, heart disease. And, you know, as Black people, we have more of that
Yes.
than anybody else. And that's why we've died disproportionately from the virus, right? Even yesterday, I was talking with a friend of mine at church, and she's 76. And she has diabetes and she's overweight. And she's a little bit scared. She says, you know, I don't think it's going to kill me. I just don't know because so many people have been telling me different things. You know, what do you think I should do? So I explained to her that all that the vaccine is doing, it's helping to alert your immune system that there's something out there that it should be looking out for.
Okay. All right.
And so when it alert your immune system and when your immune system is say, that's what you told me about with that vaccine. You're not getting in.
You're giving me encouragement now.
Yeah. And so, you know, when you think about it that way, you know, people come and they say scary things. But here's the thing, Margaret. There are lots of people out there who don't believe in vaccines, period. But as Caribbean people, we do believe in vaccine because, as you say, you got the polio, you got you got all of those things.
For chicken pox and everything.
Right. Because you see, those were the dangerous things then.
That's true. That's true.
Right.
Yeah.
And I mean, you probably have seen people with polio, right?
Yes, yeah.
See how disfigured they are. And then the vaccine came around and you don't see polio anymore.
Don't see polio anymore. It's true. It's true.
It's the same thing. Yeah. It's the same thing we want for this coronavirus.
Okay.
When the vaccine come around, sooner or later you'll be able to go out without wearing a mask.
Okay. All right.
Because you have the protection, and you'll be able to carefully take care of the older members that you're taking care of without fear that you pick it up.
All right.
You know, and then you give it to them, right?
Yeah. Because my doctor just sent me a thing this morning and tell me to make appointment because with my age, they think I should take it, you know?
Yeah. Right? So I firmly believe, Margaret, that this is not something that's going to cause you harm.
Okay.
It's going to be like you having an armor on, you know, you having an extra layer of protection.
Okay.
You know, to keep you going for many, many more years. And, you know, in 3 years, Margaret, there might be another thing.
Yeah, because it are more plagues to come, right? But you talk about church in the Bible, Revelation, it have 7 plagues. So far, there's one, right?
We don't know that if this is one of the 7 plagues of Revelation. The 7 plagues of Revelation could be something totally different, right?
You don't think so? This is one, man.
I mean, you know, we probably have no idea and no understanding of how bad those plagues might be. But at least for this, here's the thing. If you believe in God, you also have to believe that God gives different people gifts, right?
That's true. Yeah, because I have a friend always talking about what his wife is a doctor, his wife is a doctor. So up to this morning, I told him, I said, let me tell you something. If God wanted me to be a doctor, I would have been a doctor. But God gave the job to take care of the elderly. So stop bossing and telling people your wife is a doctor. Thank God she got the brains. You
Right.
understand?
Right. And so here's the thing. The same way God gave you the gift of caring and of being able to walk into that room and look
Yeah.
at the person you're taking care of and know immediately that something is wrong, something is not right. It's the same way he's given other people gifts for developing medicines.
Yeah. Okay. Yes, it's true.
Even
Yeah.
the gift of
Yeah.
understanding science and how the body works and how to protect. And you know, when people talk about healing, that God wants to heal you, what they don't actually put into the mix is that the healing that God wants to give you come through somebody else.
It come from somebody else. Yes.
Right? For the doctors and the nurses, that's
Yeah.
the healing coming from God. Many people are waiting for a miracle to protect you. The miracle is already there. It's that he has given that gift to bring that healing, right?
Yeah. Okay, Dr. Webley. You give me encouragement to you do what I have to do.
So you'll take it. You'll try and get it.
Yes, I will. I like your background. I like the background.
Yeah, it's the university that I work at. This is the chapel in the main in the middle of it, and it's still covered right now the way I'm sure New York is.
Yeah, you know, right now with the we had a little thing this morning, but not like week before.
Yeah, we just had a little dusting that they had to scrape off the car, but I suspect they said more is coming our way.
Yeah, they say Sunday we're getting more. We're getting a bigger one Sunday. Okay.
So these are times that make you want to go back to Trinidad a little bit and get some sun.
Yeah, no, right, yeah, because right now I've been in a house down there and I tell my son I want to come home because you're just sending the money and like the Monday I send home a certain amount of money. He tell me one thing, so I told them, I say, look, I want to come home, but we can't fly because the government in Trinidad ain't open the border yet.
Yeah.
They're letting out, but they're not letting in.
Right. That's their way of controlling it. Yeah. You know, that's why they have such low numbers, you know, and such low deaths as well, because they have controlled it. Places like New Zealand, for example, they didn't let people in. You have to make sure you're negative before you come in. And as a result of that, they now can walk around without wearing masks the entire time. But if you get the vaccine, that's another way that you can confidently travel too.
Yeah, because yesterday in New York, the lowest it ever hit in the past couple of months, it went down to 4 point something. So the mayor saying keep it up, you know, and then the hospitals, you know, they kind of slowing down now. They say they have since the vaccine come out, there's few deaths now, you know. Yeah. But this morning they say some doctor took the vaccine in I think it's Presbyterian Hospital, and he come down positive this morning.
Yeah, because the vaccine, it doesn't protect you right away, you know.
Oh, okay.
It's after 2 weeks. After you take it, the same way that I say that the immune system takes a while to chip in, when you get the vaccines, the same thing. So it takes about a week and a half to 2 weeks before you start having meaningful protection. And even then, you have to get the second dose to have that 95% protection.
Yeah, okay. Well, so far he's doing good. So far he did it yesterday.
Yeah.
But I have another job what I do, take care of another lady. She get her own Saturday too, but her doctor tell her to drink a lot of water. So I did that with him when he came home. I gave him a lot of water to drink. Right?
The protein breakdown, that's not a bad idea. And you know, when you take it, you know, you might feel a little sick, you know.
Yes, because my girlfriend said she took it and the second day she could not wake up, she could not get up.
It might make you a little fatigue.
Yeah, she said she okay now.
Right, because that says that your immune system is working.
All right.
It's your body working to build up that immunity.
Oh, okay. All
right. Yeah.
Well, you look.
So let me know. Let Aron tell me when you take it. All right, and we'll celebrate. We'll celebrate over Zoom.
Definitely.
Yeah. Okay. Nice speaking to you.
Bye, Margaret. Bye, Hank.
Bye.
Bye, Margaret.
Bye.
Wow, that was amazing.
Yeah, she's not anti-vax.
No,
She is hesitant.
but I
You see,
loved her description of where that comes from, the church and her mother, and you handled it so beautifully.
yeah, you see, you have to. That's why you take time to get to know people and know where their fears are coming from.
That
And
is a skill that goes way beyond medicine and science that you just demonstrated.
it's people and caring about people. When you care enough about people, you listen to them long enough, you'll know what bothers them, and you might not be able to help, but you at least know where to start. So
It's
yeah,
amazing. Well, you may have saved one person just now, and maybe many more.
I mean, and that's in our community, in the African American community, sometimes that's the way you have to go about it. You have to do it one person at a time.